Hello, everyone, and welcome to Inside Healthcare. I'm Jody Ritaka, and joining me, I'm very pleased to have with us special co-host Megan Sheldon. Thank you so much for being with us.
Thanks for having me, Jody. In this program, we'll tell you what you need to know to protect yourself against this year's flu. But first, post-acute care is a critical aspect of every community and provides necessary medical services to millions of Americans. Ever heard of it?
I imagine a number of our viewers have not, but to tell us all about it, we're very pleased to have with us Dr. Rahul Koranne. He is the Vice President and Executive Medical Director of Health East Community Services and Post-Acute Care Services. So thank you so much for being with us.
Well, thank you. Thank you, Jody and Megan, for having me. It's a beautiful fall day, and it's wonderful to be out in the community.
It's gorgeous out today. So thank you again for taking time out to do this. First of all, why don't you tell us a little bit about yourself and then also about your interest in post-acute care?
Great. I did my medical schooling in New Delhi, India, and then I moved to New York City for my internal medicine training. And then I came to St. Paul because of the geriatrics fellowship that we had at the University of Minnesota. So I've done some further study in taking care of elders in nursing homes, in transitional care units, at home with home health, and also out in the community. And then I practiced in a rural town in Minnesota, in western Minnesota, called Starbuck. And that's where I really started to fall in love with post-acute and community services. I was fortunate enough to be the medical director of an 85-bed transitional care unit and nursing home, and I also worked in the home health division there. And getting out into the community and seeing where patients are not really patients, but are neighbors, really showed me what a full person is about and how to take care of them in more holistic ways. And then I moved to St. Paul and Health East 9.5 years ago and have been fortunate to be back in the community in St. Paul and now leading the post-acute care division at Health East. So why I am still in love with this part of the continuum is because the community dwellers that use the community services and post-acute care services are so diverse, are so fortunate to have Health East and their families and themselves taking care of themselves, that it's very gratifying to be in this part of the continuum every single day and night.
Wow, what a path.
Yes. Could you just tell us a little bit more about exactly what defines post-acute care and what offerings Health East has for our community? And
So post-acute care is the industry term for this part of the healthcare delivery continuum. And so that's a lot of jargon for the services that are provided to our patients and our community dwellers and their families in their community after they have been discharged from an acute care hospital stay. Some of these services also can be used before the patient goes into the hospital so that we can sometimes prevent hospitalization. So the various offerings that Health East has in our greater East Metro community and this surrounding area are Bethesda Hospital, which is a 145-bed specialty safety net hospital in downtown St. Paul, across the street from the Capitol. We take care of the most complex and critically ill patients that come to us from all over the state and sometimes outside the state as well. So we get patients from Health East hospitals, of course. We get patients from Essentia in Duluth, from Fargo, Sanford, from Mayo, and all of the 16 or 17 hospital systems in the Twin Cities and greater Twin Cities area, right from their ICUs. So these are patients that are critically ill, very complicated, and we are honored and fortunate to be able to take care of them now for 130 years. So we've been in the community for that long, and so really a pillar of the greater East Metro community.
How's it different than a regular or a full-service hospital?
So the general community hospitals are what's called short-term acute care hospitals. So their typical length of stay is about 3 to 5 days. Some patients stay longer if they need to, but typically the patients will be discharged within that time period. Bethesda Hospital, like 430 other long-term acute care hospitals, are still acute, So we are still licensed as acute care, but
Not
we
a
are
nursing home.
not nursing home, but we are allowed to keep the patients for about average length of stay 25 days. So typically our patients come to us with ventilators, so that's a breathing machine that helps the patient to breathe. A lot of the patients are comatose and then wake up and return to function. We have a lot of patients with large wounds, burns. We have patients with transplants, renal failures. And then our third service line is neuro. So complicated patients after strokes or neurosurgery also come to Bethesda. The goal of Bethesda, like other post-acute services, is to take that very complex patient that has been through a lot and their family to the best function possible and discharge them back to their community in the best state of health that they can be. Some of the patients obviously cannot return to health, so then we also hook them up with end-of-life care or hospice. So other components of our portfolio in post-acute care at Health East are hospice care, which includes inpatient programs, inpatient consultations, but also hospice at home and hospice at the Pillars House in this community as well, which is well integrated, looks like a house in a community setting, and it's very nice for our patients and our families. We also have palliative care services, both inpatient and outpatient. We are starting a palliative clinic in our heart failure clinic. We started in March of 2013, an outpatient clinic in our cancer center at St. John's. So again, moving out to where patients and families need us. Some of the other components are obviously home health. So we have a large home health division at Health East, about 550 patients on an average daily census basis that we take care of at home with nursing care, nursing assistants, therapies, case management, and really try to integrate the patient and the family in their community. We also have complex disease case management out in the community, and these are patients that we take care of by home visit, but also by phone calls to make sure that we follow them throughout their care continuum. A very exciting piece of the portfolio or the business unit that we are working on now is the community needs assessment and our passport program. So we are looking out and working with our community members, interviewing them regarding what health care services and health promotion activities should Health East be doing to take care of our patients and our community dwellers in the community. Passport is a program in downtown St. Paul. We have about 30,000 Passport members, so a large program. And what we're working on now is falls prevention, not just treatment that can happen in acute care or post-acute care, but preventing elders from falling through coaching.
And this is something you typically hear in the hospitals, watching out for people that are at risk for falls, but now you're trying to extend it to the community as well?
Right, and that's our system view of how we are starting to work at Health East, looking at care from end to end or home back to home. So a lot of learnings from our acute care hospitals and Bethesda regarding falls prevention, falls with injury prevention, and like you said, we're taking those learnings way upstream to start to look at elders regarding fear of falling. So we are doing some research on looking at best practices. What are elders afraid of? How can we find those fears out? And what is that leading to? And then more importantly, how can we coach those elders and other community dwellers regarding falls and prevention of falls?
Major undertaking.
Major undertaking and extremely exciting.
And it's really shifting not only with Health East, as you were saying, but it's like throughout the whole healthcare industry across the country.
Right, and post-acute care, according to some data from Medicare, does make up about 23% of all of Medicare cost. So it's a big part of what Medicare is spending. And then the final component that I do want to talk about is our partnerships with our post-acute care providers. So these are transitional care units, skilled nursing facilities, assisted living facilities, group homes, and other post-acute care services in the community. We have a partner in Serenity. So we have right in this neighborhood, a Serenity White Bear Lake transitional care and skilled nursing facility, but we have about 20 or 22 other post-acute care facilities that our physicians also provide services at. So we are trying to partner more.
And you mentioned transitional care, and another term that I don't think the average person hears unless they're faced with a loved one trying to go through a transitional care then.
Right. Transitional care unit, or TCU, is a facility which has skilled nursing 24/7. And typically the patients would come from acute care, could be from an emergency department, but typically after acute care stay, a surgery, a pneumonia, or other illness like heart failure in acute care, and then to recuperate, get rehabilitation services, physical therapy at the transitional care unit so that they can get prepped and ready to return back to their community.
Temporary.
So it's TCU is a temporary stay.
And the whole point of getting people back in the community, getting them back in their homes, is because they do better than...
They do better, the patient and family satisfaction is more, the risk of infections are lower because they're back integrated in the community. And the question that you just asked really brings me to social determinants of health. And so that's again an industry term trying to look at what defines health for a community dweller. And as we are looking at it, about 10 to 15% of what determines health is healthcare delivery. So our hospitals and our clinics and our post-acute care services, about 85% of what determines health are the social determinants of health. For example, the support structures in the community, the caring daughters and sons and husbands and wives. Do you have a home that is safe and warm, or are you homeless? Diversity in many different ways and forms. So do you have folks that you call your peer network? Is there a place that you can belong? Are you dealing with psychosocial stressors in the community? And those factors we are trying more and more at Health East. As we create transitions from acute care or post-acute care to the community, we are trying to create very smooth landings, not just for the medications or the medical plan of care, but also the psychosocial plan of care to make sure that the sons and the daughters, the family is aware and is there to help the community dweller take care of themselves in their own home.
I've heard you talk before, you were saying how you would see a patient at the clinic and everything was fine and they were taking all their meds and they were well cared for. In that, when you see them in that setting at the clinic, but then when you would go to their home, totally different picture.
Right, and you know it's in our clinics, it's in our hospitals, any hospital setting, or it's even in our transitional care units. The patient, by definition, is getting things done to her. And so it's a very different ball game and a very different picture when the patient, when they walk through that door, be it a clinic or a hospital or a post-acute care setting, they transition from being a patient and dependent to now an independent neighbor, I like to call it. So that's when the daughter and the sons, husbands and wives start taking care of, okay, what medications are you on? Or myself, if I am the lady or elder that just got discharged, I have to start taking care of understanding my medications.
And those
and
medications
it's very
can be
difficult.
so confusing.
Very confusing, the medication list from previous physicians, this acute care hospital discharge, the TCU discharge, and how do all of those fit? And then more importantly, how does that fit with the family dynamics, the social services and the structures in the community, the social workers. Another example, at home, you know, we are very good at making discharge plans either from all of our hospitals or TCUs regarding the medical plan of care. But now we are starting to think about, are there wires in the home, so maybe home assessments? Are there carpets that that could trip you up and create a fall? And depression and other mental issues that can lead to hindrance in the plan of care as well. So again, back to that social determinants of health, very important, and we're keeping it front and center as we create this holistic plan of care, which is really more about health than just health care. Very exciting and a transformative journey for us, as for many other cutting-edge systems across the nation.
Makes you really think how it really is changing. It's not, we hear so much on the political side of healthcare reform and stuff, but to hear this side of it is really interesting. Thank you.
Right, and you know, the triple aim is another paradigm that that folks talk about, and it's, if you really dig into it, it's a very amazing way of looking at how to create population health. So it looks at the quality of care on broad population-based metrics. So it's not just the diabetes metric, but it's really Are you independent at home? Falling risks. How is your social connectedness? Are you activated and your family activated to take care of you? So broad metrics of quality, not just what we have been looking at for some time. And then cost, obviously cost is in there. We have to start becoming more lean. We are on a lean journey, which means we are starting to look at waste within our own system and really trying to improve our processes to decrease waste. And then patient and family experience and satisfaction. So those are the three legs of this stool. And if you look at what we are trying to do, it's really trying to get back to our mission and our roots at Health East, to look at the communities, the community dwellers, the families, and how can we truly be of service to them. And if we do that, then all of these three results will happen automatically.
And everyone will stay much healthier as a result.
Everybody will stay much healthier, and we will really start looking at healthcare as one piece of the pie or puzzle, but it's also about working with our employers. It's about working with our social services organizations in this community. So Lutheran Social Services, Wilder Foundation, Dakota Communities, Catholic Charities, to name a few. And then our group homes, which traditionally we have not brought into mainstream medicine or healthcare. We're starting to look at where our patients are, where our communities are, where our neighbors are, and how can we create a healthcare system of the future.
If someone wanted some more information about a post-acute care services, where can they get that?
So post-acute care, you could Google it, so it'll show exactly what Medicare means by that term. You can also go to the Health East website for Bethesda Hospital, post-acute care or community services, and you can learn more about our home health division or our hospice, palliative care, some of these other divisions that I'm proud to be a part of at Health East.
Thanks so much for joining us, Doctor.
Well, thank you.
Thank you very much.
Still ahead, what you need to know to protect you and your family against this year's flu. Stay with us.
Thank you. Good job.
Thank you.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards!
Oh, don't. Oh,
It went into Bob and Carol's yard. Oh, no? Okay,
Yeah.
here it goes.
oh no!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you.
Let's go.
Search We Can for more ideas on how you and your kids can get healthy together.
Welcome back to Inside Healthcare. With winter right around the corner and temperatures dropping, the flu season, on the other hand, is heating up. Joining us today to talk about the flu, how to avoid it, and other wintertime illnesses is infectious disease specialist Dr. Peter Bornstein. Thanks so much for joining us.
Hi, Megan. My pleasure. Hi, Jody.
Good to see you again. Thanks for coming back.
Welcome.
Appreciate it.
So during last year's influenza season, there are more than 3,000 people hospitalized with the flu and over 200 flu-related deaths in Minnesota. How do we best protect ourselves, and is getting the flu shot a surefire defense?
Well, sadly, nothing is surefire, but the flu shot is the best defense we have against the flu. Last year was an exceptionally bad year. Hopefully it won't be as bad this year, but as I was telling Jody before we went on, the only thing predictable about the flu is that it's unpredictable, so we don't know what's to come. So far, activity is pretty low, but the flu shot is definitely the way to go.
And who is at most risk? I mean, who should be getting the flu vaccine?
Well, the Centers for Disease Control, their recommendation right now is if you're over 6 months of age and there's a lot of flu vaccine available, which there is, that pretty much everybody over the age of 6 months should be immunized. They do have some high-risk groups that they're interested in when there's a relative shortage of vaccine, but we don't have that this year. So if you're over 6 months of age, it is recommended that you get a flu immunization.
What about pregnant women?
Pregnant women, definitely. They're especially a high-risk group, both because of their pregnancy and also because the newborn is entirely dependent on the mother's immunity for the first 6 months of life. So the only way to immunize your newborn is for the pregnant woman herself to get immunized.
And for those of us who aren't a fan of the traditional injection shots, would you recommend the mist at all, or what's the difference between the two vaccinations?
Sure. So the flu shot, first we'll talk about that, is what's called an inactivated vaccine, which means it's not a live virus. You can't get the flu from the flu shot. But the flu mist or the nasal vaccine is a live virus. It's a very mild form of the flu. It doesn't cause influenza-like illness as we understand it. but it's a live virus vaccine. So there are certain groups of people who should not get the flu mist or the nasal vaccine, and that includes people under the age of 50, includes people who have any kind of immune compromised status. So if you're over the age of 50 or you have some kind of immune status, you should still get the flu shot.
Okay.
And it seemed like last year when we did have that epidemic outbreak of the flu that some were concerned that they got the flu vaccine and it wasn't effective. How effective is a vaccine, whether it's the mist or the
Right.
or the shot?
So we usually like to think of effectiveness of vaccines in two different ways. One is, what's the effectiveness for an individual? In other words, if an individual gets a shot, how effective is it that they're not going to get the flu? And unfortunately, the flu vaccine is probably around 60 to 70% effective. It's not 90% effective as some vaccines are. But the other way to look at immunization is a group. So if you have a large group of people, if nobody gets the flu shot or nobody gets immunized, it's very easy to spread the flu within that group. But if you have everybody getting the flu shot or immunization, then only 30% of people are vulnerable. And so you get some protection. Even if the flu shot didn't work in you, the fact that everybody else got immunized reduces your risk of getting the flu. And that's what's behind the recommendation that pretty much everybody get the flu. It's not 100% protection for an individual, but the more people who get immunized, the better off we are as a community.
And I understand the vaccine is based on certain strains that the CDC anticipates that we will be seeing. What are the ones that this year's flu shot protects you against?
Right, and it's more complicated this year because there's two different kinds of vaccines. There's the traditional trivalent vaccine, which protects against 3 strains of the flu, and then this year we've come out, or the manufacturers have come out with a quadrivalent vaccine that's 4 different strains of the flu. So the traditional trivalent vaccine, which has 3 strains, is 2 type A strains, H1N1, which you may recall a few years ago was especially severe, and then another one called H3N2. And then the 3rd strain in the trivalent vaccine is a type B strain. And type B strains typically come later in the flu season, but they, like I said, they can come anytime. What the quadrivalent vaccine has is a 2nd type B strain. So for people who are getting the quadrivalent vaccine, they're getting 2 type A's and 2 type B's. For the trivalent, they're getting 2 type A's and 1 type B.
And do we know why they switched or why they've gone to the quad?
Yeah, well, it's recognized that there's more than one strain of the flu that circulates at any time. And there's always a little bit of a gamble. The authorities who are responsible for picking the strains have to pick back in March, guessing what's going to be coming 9 months to a year later. So the more strains that you can pack into the vaccine, the more likely you are to prevent influenza transmission. As you may recall, some years ago, the vaccine was not what we call well matched. They didn't have the right strains. So trying to put as many strains or at least as broad protection as we can into it. That said, the best vaccine to get is the one that you get. So I wouldn't hold off trying to get the quadrivalent vaccine and pass up the trivalent vaccine if that's what's available when you can get it. So get the immunization as best you can. But the quadrivalent is going to be one more strain protective than the trivalent.
So we already kind of touched on the nasal vaccination, and it could give you some symptoms, but what about the injection one? Do you ever see people that get symptoms of that? You hear those rumors every year.
Sure. So one thing I often hear is, I got the flu when I got my flu shot.
Yeah.
I hear that a lot. So I got my flu shot a couple weeks ago, and the one thing I did get was a sore arm for a few hours. So that's a common reaction to the flu shot. Usually that means that my immune system is responding to the vaccine. So I didn't mind the soreness, and it went away after a day. But what happens with the flu shot is it doesn't cause influenza. Bear in mind that this time of year, right now we're talking in October, there's lots of stuff going around. I mean, there's lots of viruses going around. Influenza itself is relatively low. So the chance of any individual getting a flu shot and then coming down with a respiratory illness, it's not insignificant. It could happen. The two are not connected, though. So the flu shot doesn't cause influenza, but it doesn't protect you against every potential form of illness either. The other thing to remember about the flu shot is it takes 2 to 4 weeks for the immunity to build up after the shot's been given. So often people ask me, what's the best time to get a flu shot? You know, should I wait? Should I wait until the flu is out there? And the answer is no, because if you wait until the flu is already running through the community for you to get the flu shot, then you're too late. So I usually tell people, well, you want to get the flu shot 2 to 4 weeks before you're exposed to the flu. So when you know when you're going to get the flu, then back it up a couple of weeks.
And I know it's really early still, it's only October, but what are you seeing out there? You did mention there's some other viruses floating around, or?
Sure. Well, there's always respiratory viruses that go around. This time of year, as an infectious disease specialist, we deal, of course, with infections all year round. We're coming off of Lyme disease and tick-borne illness, and sometimes we get a few more of those in October. With school back in session, school kids are really good at transmitting infections between each other in the classroom.
And then bringing it home to mom and dad and the rest of the siblings.
Right.
Yeah.
So often this time of year, you'll see people get sore throats, scratchy throats, the kind of the classic viral illness. Remember, the flu is not just a sore throat. The flu is very high fevers, very severe sore throat, respiratory illnesses as well.
You know, on that note, maybe you can kind of talk about what are the symptoms of the flu, and then maybe some treatments.
Sure. So,
whether they got the vaccine or not.
Yeah, so whether they got the vaccine or not. If you have the flu, typically you're going to have a high fever, usually over 101, 102, 103. You'll probably have a sore throat. You'll probably have a cough. It may not be a productive cough. In other words, you may not be coughing up any phlegm. You'll have very severe body aches. You might feel like you got hit by a truck. Those are kind of the classic influenza-like illness.
It comes in overnight, too.
It can come in very fast. One of the things about the flu is that the incubation period between when you're exposed and when you develop symptoms is 2 to 4 days. And you can be what we call shedding the virus, in other words, transmitting it to other people, anywhere from a day before you have symptoms to 5 to 10 days after there's symptoms. You're most infectious when you're having symptoms. So another reason not to wait to get the flu shot, and another reason why healthcare workers, we especially recommend that they get immunized because they could be transmitting the flu even before they feel sick. And we want people not to be transmitting the flu if they have a chance to avoid it.
So the healthcare workers, it's more not to transmit it to their patients versus keeping them healthy, or vice versa, or
Well, it's
both?
not an either or, right?
Yeah.
It's a both. You know, healthcare workers are a valuable resource in our community. When they get sick and have to stay home because they have the flu, it stresses the hospitals and the clinics even more. So especially important for healthcare workers to get immunized because they're the front line. Healthcare workers, police, fire, EMTs, so forth.
We just have a minute left. Final comments about this year's influenza season and advice about the vaccine itself?
Sure. Well, for people who are interested in finding out more, websites flu.gov, flu.gov.
And it's operating even though there's a shutdown as we speak
So
here?
as we speak, there's a government shutdown. I did go to the website last night. It is up. It has some very good common sense information, a lot of the stuff that we've talked about today. It's not being updated with new information, so there's no new data on how widespread it is. And if someone's a real wonk about the flu, there's a really cool website called google.org, not google.com, google.org/flu trends, where Google is keeping track of what people are searching for on the web, and then based on that, they're producing a map of how active flu is around the world or around the country. And I did check that last night too.
And what did we
Everywhere's
find?
low right now,
Okay.
except for Eastern Europe. And then New Zealand, which is just coming out of their flu season, they're moderate. But nobody's high right now.
All
Things
right.
are quiet for now. Touch
Well,
wood.
as always, great information. Glad to have you back with us. So thank you for coming here.
It's a pleasure.
Appreciate it. And we'd like to thank my co-host today, Megan Sheldon, for being here with us today.
Thanks for having me.
It's been awesome. So thank you so much. Thank you. And we'd like to thank you for joining us. We hope you'll join us next time on Inside Healthcare. See you then, everyone.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.